you. I think this will work.
Awesome. Okay, so in regards to the question about stimulants, there's kind of a short and a long answer, and I will give the long one for the sake of just covering everything that needs to be covered. So when you talk about stimulants, obviously there are positives and there are drawbacks with any stimulant. But that said, the positives for weight loss, for energy levels, in general, far outweigh the negatives if they're done correctly. Now, the problems with stimulants arise when people dose them incorrectly based on their weight and also based on their sensitivities as well as their previous stimulant use. So the biggest factor when it comes to making sure that you dose stimulants correctly is looking at someone's body weight and looking at previous studies done on average, someone between 150 or 120 and 150 pounds on average. That's the usual study range. So when we were developing Zing in particular, we strive to find people that fit our average target audience. So typically that's women who are in the age range of 30 to 50 roughly, who need to lose with lean anywhere between 10 and 30 pounds. So we're looking typically, again, in that 120 to 150 pound range for a female, and that's how we're usually dosing our products. So when you look at those statistics, right, that range, that weight, that age, that gender, there's an upper safe limit amount for each really body weight for stimulants. So when you work backwards off of that upper safe range, a product like Zing has 1/10 of what's considered safe at that weight for Yohimbe. It has 1/3 of what's considered safe at that weight for Synephrine. And then the caffeine is well within normal range at less than 90 milligrams per serving. So the thing to keep in mind across that is it's not like we're underdosing those ingredients. What we're doing is we're taking those ingredients and combining them in such a way so as to enhance the overall effects for energy and for fat loss without causing unnecessary increases in blood pressure or causing nausea, headaches, and all the things associated with really overdosing one stimulant, which is what a lot of products do. You'll see them load up and push that upper safe limit with Synephrine or with just Yohimbe or whatever it may be, and that's when you get sort of those side effects. That's when you get more of a dependency, whereas in these lower doses, actually, as we dialed them in, we noticed really all the benefits and none of the drawbacks. As in, when we were doing our testing, about 95% of the time, no one even noticed an increase in blood pressure, which is pretty fantastic given the fact that stimulants typically do increase blood pressure slightly. Now, again, going back to the dosing, another thing to keep in mind is when you take the product. So we recommend for maximal effect taking Zing on empty stomach, but we recommend for naive or new users who have not used, typically have not tried these stimulants before, haven't tried them recently, that those people take the product the first time with food. Now, the reason for that is because a product like Yohimbe is most effective in a fasted state, and when taken with food, you're able to mitigate a lot of the effects, and that weakens the product even more. So you're not likely, again, to get that increase in blood pressure, increase in heart rate, things like that, while you still do get a significant amount of the benefits from the rise in circulating noradrenaline. Okay, so overall, there are a lot of fantastic benefits to Zing. And then when you take a look at Accelerate, similar thing. Accelerate, we're talking about, a combination of teas and other ingredients where, the sum of the parts is greater than it should be, right? So when you add these teas together with guarana, kola nut, and cayenne, you get a more profound effect for weight loss than you technically should, and that's just because the smart combination of ingredients leads to an enhanced effect, right? And there's less than 50 milligrams of caffeine total in Accelerate, so it's a very, very low caffeine product. And on top of that, again, there's really no other stimulants outside of caffeine in here that are not just, alkaloids and things like that. They don't really have a profound effect on blood pressure or anything like that. Now, one of the most common questions I do get has to do with dependency. Now, everyone knows that caffeine is slightly addictive. That is absolutely a true statement. There are caffeine withdrawals when people stop caffeine after long-term chronic use and things like that. However, that said, most people consume more caffeine than they would in a serving of Zing than from their morning coffee, right, or from soda throughout the day or whatever it may be. So if you're just replacing those things, you're not really causing any sort of profound difference. The other thing that we do to kind of combat that is recommend people take a break every 3 to 4 months. That way they can prevent sort of that adrenal dysfunction, and also they typically won't have, the severe headaches and things like that a lot of people have when they come off of caffeine. So that's a great way to combat that. But that is present with caffeine. The good news is it's not present with epinephrine and yohimbay. They haven't been shown to have any addictive properties. They also haven't been shown, as far as long-term safety studies, to have any real negative effect, any sort of effect as far as even at the upper limit of that recognized as safe dosage is all short-term. It's until the product is actually metabolized. So that's important to keep in mind that if there were a slight increase in blood pressure or heart rate or anything like that, that's not going to cause, sort of a long-term health issue. That's more of a short-term while it's being metabolized, and then that effect subsides. Okay, so that's important to keep in mind as well. But really the bottom line is, when it comes to the stimulants in our products, we don't just blindly throw together a combination of stimulants and say this is fine. We've done the work, we've done the testing, we've done more so far and above what we typically have to do to really show the safety of the product. The reason why it took us a year, almost more than a year on Zing is because we were going back every single time and doing the blood test and doing the short term to see if the heart rate increased, to see, how much metabolic rate increased, to see how many additional calories were burned. We're seeing if blood pressure goes up. We're reporting side effects and seeing what we can do to mitigate those. And that's a never-ending process. As we brought the product to mass market, we've noticed some things that we didn't necessarily see in testing. And as we go forward, we continue to improve the product constantly. It's a never-ending process. And that's one of the things that sets us apart, too. We're not just putting out products that have 300 milligrams of caffeine and they're going to jack up your blood pressure and your heart rate and all those fun things and dehydrate you. We're very conscious about how we design our products and the safety testing that we do behind them.